tune in and call into my show Sunday mornings at 10 on Talk 1470 WNN.
This is Talk 1470.
Talk 1470.
WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Good evening, listeners. Thank you so much for tuning in. You're listening to the Balancing Life and Business Show with Norma G. And today we're going to be discussing Got Pain Avoid Surgery with PRP and Stem Cell Regeneration with Dr. Luis Escobar. Good evening, Dr. Escobar. How are you today?
Good evening, Norma. How are you doing?
Wonderful, wonderful. We're so glad that you're here today, and we're going to learn a lot about any of you listeners out there that may have some low back pain or shoulder or knee pain, because there's a treatment out there that can help you live without pain and to live and return to your lifestyles. If you'd like to listen in, you can listen in on your car radio at 1470 on your dial, on your computer at wwnnradio.com, and at AMP2 TV Productions on Facebook. You can also listen on your iHeart app at 1470 WNN. And if you have any questions and you want to call in and ask any of your questions to Dr. Escobar, you can reach us at 1-888-565-1470. I'm your host, Norma Guerrero, this evening, and today Dr. Escobar will be talking about solutions to your acute and chronic pain conditions using the latest medical advancement technique called platelet-rich plasma and stem cell therapy. Dr. Luis Escobar is an anesthesiologist and pain management doctor. He is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in South Florida for over 15 years. Dr. Escobar has 3 offices called Pain Care Specialists of Florida, and they are a leading provider of interventional pain management. Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function with your normal life activities. He has 3 offices that are bilingual. They're called Pain Care Specialists of Florida, located in Aventura, Pembroke Pines, and Hollywood. His office contact number is 954-322-8586. His website is www.painconsults.com. And he also can be found at Pain Care Specialists of Florida on Facebook. So, Dr. Escobar, thank you so much for coming in. The reason why I'm really excited about you being here today is because there are so many people out there suffering with pain. And they're tired of going to doctors. They're tired of missing work. Are you out there and your doctor may tell you may need surgery now, and you're saying that there's a procedure that you perform in your practice called PRP and stem cell therapy. Could you explain what that is to us?
Yes, I can. Well, definitely there's many treatments prior to going to surgery. Traditionally, we have treated injuries with the least invasive mode of treatment. We start with bed rest, some anti-inflammatories, physical therapy, and if this doesn't help, then we move on to what we call interventional pain management. Traditional interventional pain management has been carried out with corticosteroids, which is a very strong anti-inflammatory.
Is that what people call a cortisone shot?
Exactly.
Okay.
Cortisone was the first steroid that was developed. It had many side effects. Now, lately, we have better corticosteroids They have better response with the patients, and that's basically the next line of treatment. Many times they work, and sometimes they do not. And then at this point, the patient is left with the choices of surgery or don't do anything and continue suffering. So this when these new treatments come into play. We are using the patient's own body and the cells that exist in our own bodies, which is called stem cells, which is the progenitor cells, if you will. They are left in our body from when we were created to help us regenerate injuries when they happen.
So you're trying to tell me that you take part of your own body and then you put it back into your body?
Exactly.
And what's that called again?
We are using the stem cells that are left in our body. Stem cells normally will regenerate any injury, small injuries such as cuts in your skin or small tears of different tissues. Sometimes, if the injury is too large or the patient has certain deficiencies or doesn't have the appropriate follow-up after the surgery, after the injury, the body may not be able to heal this injury on its own. So what we do, we go into the patient and take those cells from where they exist, mainly in the bone marrow and or the adipose tissue in the body where they're the most abundant in the body, harvest those cells and then treat them in our lab, separate the good cells from the bad cells that are needed for regeneration. And once we have these stem cells separated, we mix them with what is called platelet-rich plasma, which is cells that are taken from the patient's own blood. Again, treated in our lab, separate the red cells from the leukocytes and just left with the platelets, which are very much involved in the regenerative treatments. So we mix those two together, stem cells and platelet-rich plasma, and inject them precisely at the site of the injury to promote the healing process.
Okay, so let me try and understand this, because I heard about stem cells years ago when people are trying to treat different conditions, disabling conditions. So you're saying that people that just have a back pain, a knee pain, a rotator cuff injury, that they can actually use these same types of stem cells to not have pain in their body and perhaps avoid surgery?
Yes, exactly.
That's incredible.
It is amazing. The stem cells in our bodies are aimed to regenerate any injury, regardless of whether it's musculoskeletal, which is where we specialize on, but also in other injuries, systemic injuries, in diseases. So when those cells are not sufficient and we go and harvest them and re-inject at the precise area of the injury, when I say exactly at the precise site of the injury, we locate these areas. First of all, we have the right diagnosis. We know what is broken. And with precisely either fluoroscopic guidance and or ultrasonography, we direct these cells to that area with needles.
And how do you obtain the stem cell or the plasma?
Well, the stem cells are harvested from your own body, the patient's body, either from the bone marrow, and or the adipose tissue. They're the most abundant in the body in these two areas. After harvesting, we go through a process to separate the good cells from the cells that are not needed for regeneration.
Where's the adipose tissue?
Adipose tissue exists in all our bodies. I mean, more abundantly in the abdomen, in the buttocks area, and the hips, which are the most common areas that can be harvested from.
Wow, that's pretty incredible. And so now, when you re-inject it back into the body, do you re-inject it directly into the pain site or just into the bloodstream?
Well, there's two different ways of treating injuries, and when we treat the musculoskeletal injuries, we want to go exactly at the site of the injury. So if we have any disc disease in the spine, we have a spine model here. And this would be the bone. This is the disc in the spine. These are the discs, the nerves. I'm sorry. And when you hear a patient saying, "Oh, I have a pinched nerve," what happens is that the disc ruptures and puts pressure on the nerve, and that gives you the classical sciatica, if you will.
Okay.
So, which is the classical pinched nerve. So, when the traditional treatments have not been successful, we can treat those injuries and the pain from those injuries with a combination of stem cells and platelet-rich plasma.
And how many treatments will somebody need if they receive this type of treatment?
Well, depending on the injury. I mean, most injuries, when treated with stem cell treatment combined with a platelet-rich plasma, tends to be only one single treatment.
Okay. When treated with the stem cells?
With the stem cells.
Okay.
More injuries treated only with platelet-rich plasma may require more than one treatment, sometimes 2 or 3 treatments. The difference between the stem cells and the platelet-rich plasma.
Yeah, I was trying to understand the difference between the two. What's platelet-rich plasma and what's stem cells?
The stem cells are pretty much the repairman, if you will.
Okay.
The contractor that is going to actually orchestrate the healing process. And the platelets that come from the platelet-rich plasma are pretty much the tools that the repairman is going to use to regenerate the injury. So together, they work dramatically better than by themselves.
So you're saying that if you have the combination of the platelet-rich plasma and the stem cell, the impact of the regeneration is better than just solely using just the platelet-rich plasma?
That's correct.
Okay. And so how do you obtain the platelets from, I understand how you take the stem cell out of the adipose, but how do you obtain the platelet-rich plasma?
Well, for the platelets, it's a very simple process of drawing blood from the patient. And after we have the blood for some knee injection, perhaps we will take a large syringe, 60 cc's of blood, process it in the lab via centrifuge, separate the red cells, which are not very good for regeneration and have a lot of inflammation properties. It take away also the white cells that we don't need for this type of treatment, and just keep the platelets. The platelets are very rich with growth factors and cytokines, which are chemicals that are very much involved in the regenerative treatment and repair of injured tissues.
Wow. So if I am having a problem in my back or in my shoulder, and I've gotten to the point where the doctor is saying that I need surgery, you're saying that perhaps consulting with someone like yourself, a pain management specialist, and maybe just looking into this procedure to see if I'm a candidate. Who's a candidate for this type of procedure?
Well, that's a very good set of questions. First, I believe you ask, how do you look for help, if I understand the question? Absolutely, you can call our office. And first of all, we have to have the correct diagnosis.
Okay, so first you have to know what the problem is.
Correct. Once we have identified the problem, then it's a lot easier to treat it. And like I said, these type of treatments are very precise. So we have to go and put the medication right where the injury is. And once you come and see us in the office and we identify the problem, treat it, most likely we will help you avoid surgery if that was the next plan.
What type of condition does someone have that they would not be a candidate for PRP or stem cell therapy?
There are very few patients who would not be good candidates. Let's talk about which will be the good candidates. And pretty much anybody would be a good candidate that has any injury, musculoskeletal injury, that wants to use their own body to regenerate itself instead of having surgery. Okay, in any injury, shoulders, as you mentioned before, knees, the spine, cervical, thoracic, and lumbar spine, knees, elbows, ankles. Also, any patients who have any injuries to the soft tissues, such as the muscles and tendons, soft tissues of the knee, like the ligaments and tendons, the meniscus, the labrum in the shoulder, all the soft tissues also are amenable to this type of injuries.
And do you find that there's a difference between whether or not someone has an acute pain, like they just recently got injured, maybe in the previous month or two, versus a chronic pain, a condition that someone's had for months or if not years?
There is a significant difference. When you have an acute injury, you have already activated the regenerative process. You once we have an injury, the body reacts, and there's signaling involved that attracts all the cells to the injury area, including stem cells.
When you first
and
get
platelets.
injured, the
When you-
body naturally kind of does
Correct.
this regeneration.
That is the
thing.
normal response of the
Okay.
body. If the injury is a mild injury, let's say a cut in the skin, I mean, platelets run to that area and try to stop the bleeding. That's the first function. And once this is stopped, then there's signaling for other growth factors to come to the area to regenerate that wound. And that's where starts the healing process. Then next thing, you're going to have a scab, and then eventually scars, and that became the healing process. If you have an injury big enough that your own body cannot heal it, then this is what any of these treatments will come into play. What we do, we go and harvest the cells from where they exist in very abundant fashion. And I'm talking millions of cells, many millions of cells. Well, we harvest those cells and then bring them to the injured tissue to continue this process of regeneration. So this is nothing out of this world. It's not magical. It's just bringing the power of your
It's
own
almost like a
healing
booster,
process.
like a boost.
It's like a huge
Boost.
Yes.
Yeah, because you're using your natural body's
Correct.
platelets and stem cells.
And with the number of cells. I mean, let's say if you were able to bring 1 million cells, now we're going to be bringing 100 million cells to the area. So the healing process is going to be multiplied by a factor of 100, if you will, or more.
That's incredible. And so now, is this procedure performed in a hospital? Do I have to be admitted into a hospital, or is it an outpatient procedure?
This is an outpatient procedure. We do it right in the office. We have
Really?
Yes.
So that's it? I can go home after I get it done?
Oh, for sure. We don't want to stay in
Because
the
it seems
office.
so, whenever I hear the word stem cell, I'm thinking it's very serious and complicated and bone marrow that,
It's not complicated at all. It's an outpatient procedure. You come to the office, we harvest the cells, process in the lab, you prepare the area for re-injection, and in 2 hours, you're on the way back home.
Really?
Yes.
And so do I need to maybe do some physical therapy after I get this type of injection, perhaps?
Immediately after the injection, we don't want the patients to be too active because we want the cells to stay in the area of the injury. That's pretty much the reason why we inject the cells exactly where the injury is. So we don't want those cells to move out of the way, if you will. So we prefer to stay for the first week or two, not very active. After that, therapy is tolerated.
Yeah, if needed. That's incredible. Mm-hmm. And so now, are your clients, are they coming in complaining that they're tired of being on pain medicine? They're tired of the way that the pain medicine makes them feel, and that they come to you looking for alternatives? And would this be a good way to wean yourself off of pain medication, doing this type of treatment? It
would definitely be a good way to regenerate their injuries, and if the pain medication is part of that scheme, yes.
Because when you have pain medications, you have anti-inflammatories, and these types of medications, you can become dependent on them. And if you're out there and you have pain and you're just tired of living that way, this is a wonderful procedure that if I did my research properly, I know that many elite athletes have done this over the years because they get injured on the field, whatever sport they're playing. And what I've read is that they get the stem cell, the platelet-rich treatment, and they find that their speed of recovery is significantly better and that they're able to get back to their lifestyles. And so I understand medicine as well. I treat patients as well, that when I see people dependent on medications, I find that their lifestyle deteriorates. And so I really want to continue to talk to the listener about how this treatment can really reverse their healing and restore their life.
Correct. As you mentioned at the beginning of the statement, yes, this treatment has been used by athletes, and those perhaps are the best patients for this type of procedure, because you have a very in shape body, if you will. I mean,
Okay.
they're in the perfect shape, and there's something that has fallen out of place. They have all the basis to heal properly, given the right tools. And perhaps in some of the injuries they don't have the enough cells in the areas of the injury. And if we help them with a boost, as you called it before, for sure they will speed up the healing process. Probably decrease by to 1/3 of what normally would have been the healing process without our treatments. And it's very effective on them. And the reason I say that the athletes will be the perfect patients, because we have to optimize whatever our patients are going to receive the treatments, avoid everything that will be working against the healing process. Common things that people do is smoking, alcohol use, not very healthy habits. And you mentioned something very important, anti-inflammatories. Anti-inflammatories are not very good for healing. Remember the anti-inflammatories. So they stop the process that the body is trying to create to start the healing process. So all the medications that patients take, like anti-cholesterol medications, anti-triglyceride medications, also work against the regenerative process. So we like the patients to stop those medications during the treatment process, as well as try to improve the body habits.
Well, it just sounds like it's a treatment that is, in a sense, kind of holistic, because it's somewhat natural. Would you describe it as holistic, as natural? Because you're using your own body, you're injecting your own body into yourself?
Well, I'm not quite sure that you call it holistic. When I think holistic is more of a natural outside of the body. Yes, this is just, let's say, a promotion of your own healing process, and try to maximize what your body already does. Natural, yes. Holistic, I don't know. But
That could be a play on words. But you mentioned that elite athletes are prime candidates. I mean, they're prime candidates for a lot of things because of the way that they care for their bodies. But when I think of South Florida, I think of a lot of people are runners, a lot of people are golfers, a lot of people bike riders, and so in a sense, the population of people down here in South Florida, I find that they're elite to a certain degree as well.
Oh, but absolutely
your
right.
weekend warriors.
You're absolutely right.
And
these
so
are athletes.
They're
not professional.
There's a lot
athletes,
of people
but
down
they are
here
athletes.
that they don't want to. When people are having to face surgery, they're going to be out of work for 4 to 8 weeks, and you lose money and you lose time, and you're also, you cut into the body when you have surgery, and so you're saying this as well as works as an alternative to surgery.
For certain injuries, yes. There's a set of injuries that must be treated by surgery.
Okay.
So,
would that be like if you're talking about a shoulder or a knee, like a partial tear or a complete tear?
That's a very good comparison. A complete retracted tear is not going to heal with.
So if you have a
these
completely
treatments.
retracted tear,
Correct. If you have
it's very difficult.
a tendon that is like this, and all of a sudden it's like this, and you have a big distance between the two ends, it's very hard to bring them together with this type of treatment. If you have a partial tear,
Okay.
then that would be a very good patient to be treated with this mode of treatment.
So when people go, people complain of shoulder pain, and they go get their MRI, and either their doctors read them, or you can read at the bottom, it'll describe the type of tear that you have. And so you listeners out there, if you have a partial tear, you're very well may be a candidate for stem cell and PRP therapy. So, you may want to consider that before embarking into the avenue of surgery, which requires a tremendous amount of recovery and immobilization as well. So,
And still requires healing. So
it still requires healing.
And very interestingly, the Orthopedic Society in certain segment of the orthopedic surgeons are integrating these treatments into their surgeries to promote the
right?
healing thereafter. So it is becoming more and more mainstream,
Okay.
the use of stem cell and platelet-rich plasma instead of or with, during surgery, and or after the surgery to promote the healing. So one does not preclude the other, and they can work in conjunction.
Now, Dr. Escobar, we mentioned at the beginning of the segment that you also have a background in anesthesiology. And I've witnessed you do some work, and I found you to be quite impressive in your care with your hands. You were very detailed, and you had a very tremendous care and ability to be able to guide the fluoroscopy and the ultrasound in order to locate the injection. How does you, being an anesthesiologist as a background, how do you feel that makes you not necessarily more skilled, but what does that bring to the table, that background of anesthesiology? Because I find that to be a tremendous, background that you have. I mean, it's a very special training that you have.
Well, thank you for the comments. Nice comments. The anesthesiology is the pretty much the mother of interventional pain management. So as anesthesiologists, we do a lot of blocks, we call, for surgery. We do epidural injections, spinal injections, specific nerve blocks like cervical plexus block or femoral nerve block, depending on what surgery the patient was going to have. So we were very skilled originally as anesthesiologists in directing needles to the right places. Then interventional pain with the addition of fluoroscopy, and then lately with the addition of ultrasonography, we're much better to get into the precise size of injury.
Well, that's definitely when I had the opportunity to witness you caring for your patients. That preciseness and that detailedness is what I was most impressed with. So, if you are out there listening and you're living with pain, you may want to look into this procedure at Dr. Escobar's office. He is available to answer any of your questions and to consult with you and to see if you meet the criteria to receive this treatment. He, again, has 3 offices located in Aventura, Pembroke Pines, and Hollywood. The name of his offices are Pain Care Specialists of Florida. His contact number is 954-322-8586. Again, the office is bilingual, so if you're Spanish-speaking out there, he and his office personnel can help you. His website is www.painconsults.com, and he can be found on Facebook at Pain Care Specialists of Florida. Dr. Escobar, I want to thank you for coming here today and helping us, giving us hope with a procedure that you're able to help us live without pain and perhaps avoid surgery. And I think it's wonderful that you're doing this procedure, and I hope that you're able to continue to help people out there.
Thank you for having me today, Norma.
You're welcome.
It's a pleasure to be here.
You're welcome. Thank you for coming.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.